everybody, Suzanne Conversation with Adulting Visions Hypnosis and Reclaim Your Practice in Your Life. Today's video is called So You Thought You Wanted to Be a Therapist. These days with the wonderful or not so wonderful health problems that people are confronted with, most especially in their own minds due to a lot of the garbage that they watch on the media, especially in the so-called news. We have a lot of people who are going through a lot of suffering these days. And some of those people who are suffering are not necessarily just the patients, but the practitioners, the therapists themselves. I've heard from quite a few therapists who are not very happy with the way things are going for many different reasons. And I know I experienced some of these things when I was in the conventional world of psychiatry. When I was working with psychiatric patients back in the day, who needed support just to live their lives. So I'm going to go through a few of the things that I know are bothering folks who are in the conventional world of therapy. The first one is that they too are people. They have emotional needs. They need supervisors who can help them without making them feel poorly for whatever they may need to bring up regarding what's going on with their patients. Input to help them, not to be condescended upon or made to feel badly or to feel incompetent for not knowing what to do or even feeling, hurt, upset by something that one of their patients may have said to them. Supervision is supposed to be a safe place to go, to get assistance, to get a feeling of support and best practices. However, that doesn't happen in all too many cases, sadly. And I know this is true from the supervision I had in the lowly places that I worked back in the supported housing, where my bosses really did make my life really miserable. They made the lives of my clients even more miserable because they were not capable of understanding that their job was not to keep people down, but to help people aspire to be the best that they could be, both for the person who was working with the patients and most especially the patients that were being paid to help. No, it's not a concept, folks. Helping the people who are paid to help? My God. Payment. Oh my God, what's the deal about payment? Really low pay for the work that they're doing, especially when they're brand new therapists. Many cannot make their bills, especially when you add on the student loans. And then fighting with the insurance companies to get reimbursement for sessions that already had happened, or even getting extra sessions for those patients who truly need the extra support. And they don't get paid for that time. And it can take hours being on hold with an insurance company over and over and over again, sometimes for months, to get the reimbursement or the okay to bill for those sessions that their patients need. And what about a system that is more aligned with the pharmaceutical companies in pushing drugs, legal drugs, that cause all kinds of toxicities for their patients, especially when they're giving multiple drugs. You're drugged for one problem, maybe they have some depression going on, so they get an antidepressant, and then they end up shaking, so then they end up having to go on a beta blocker. I actually experienced this myself, so I can speak from experience. And then sometimes they have other issues, the sleep disturbances, and they need a sleeping aid, and it goes on from there, and that's where they actually make all their money. In the psychiatry, not the psychology. And that's a problem because, as happened in my case, my kidneys started slowing down, and luckily my psychiatrist is very up on what was going on, and she had me do a cretin level, 24-hour collection of urine to find out what's going on, and yes, indeed, that was the issue. She immediately took me off the medication, and very shortly thereafter, I was able to clear my problems using timeline therapy with Tad James, who created that, teaching me which negative emotions I needed treated, because he couldn't teach that in a practitioner or a master practitioner training, because most of those folks had no understanding of anything to do with mental health. It would have been way beyond the scope of the training. So these are the issues, some of them, that therapists are dealing with. They're dealing with overwhelm. Some of them are getting sick physically and emotionally, burnt out, and just not feeling like it's worth it anymore. But I'm here to tell you that there's ways that you can actually continue doing this wonderfully fulfilling work so long as you take care of yourself, so long as you have the tools and techniques to really, truly, quickly, and effectively help your clients heal. It's not about drugs. It's not about management of symptoms. It's about clearing the problems at their cause in the subconscious mind where the transformation needs to happen. And in order to do that, you need to be able to learn hypnotism and neurolinguistic programming. Timeline therapy, which is a form of neurolinguistic programming. And neurolinguistic programming is a form of hypnotism because you're still working in the subconscious, unconscious mind, which is really the amygdala of the brain, versus the prefrontal cortex, where all you therapists were actually trained to work, which is the hardest place to work because that's where the patients come up with all the reasons and rationalizations and judgments as to why it is they can't do the things that you're telling them to do, all those lovely suggestions you give them. Especially if they're depressed. They'll sit there and go, I don't know, but I can't. No way. I couldn't do that. You've heard it all, and so have I, but I don't put up with that crap. I just throw them in a trance and I get them to shift their thinking so that they can come out of that and actually have a quality of life that's worth living. Because, at least as far as I'm concerned, there's no point doing this work if you can't help your clients be happy, healthy, contented, and having fulfilled lives. Everybody deserves to have that to whatever degree they're capable of doing, and that's not up to us to decide. It's up to them to decide based on the work they're willing to do with us. So there you go. That is my message for you for today. I thank you as always for spending your time with me. Till next time. Bye-bye all.